Children's Hospital has a long history of creativity that has transformed the fate of children. A half a century ago, Robert Gross showed us that you could operate on the hearts of newborns. And I'll tell you how personal that was, because in my first week of internship as a Brigham surgeon, my son was born with a cardiac defect that put him, at the very start of my own training, in the intensive care unit in the PICU at Children's. And the technologies and capabilities and people who saved him didn't even exist 15 years before. I would not have him. And he is graduating from high school this year. That's what transformation can do. And that alone is the reason why I'm really delighted to be here at this moment for you, to help you understand what innovation really means. The way I want to understand it, though, is how differently the challenge of creativity and innovation, how different it has become as we enter the 21st century. And one of the ways I want to tell you about it is by telling you the story of someone who did not benefit from innovation. A young man named Dwayne Smith, who wrote me a letter after he had had a head-on motor vehicle accident in East Texas. Broken leg, broken pelvis, broken arm, both lungs collapsed, and internal bleeding. They got him by helicopter to the nearest hospital. There they were able to attempt to get him under control, but they still found that he was bleeding from somewhere. They didn't know quite where, and they couldn't get his blood pressure up. They found that his spleen had ruptured, and so they were able to remove his spleen, stop his bleeding. He's grateful for it to this day. But there was one small step that they missed. One of the innovations that have come out of the last half century has been the vaccines that could target the bacteria that the spleen has a special capacity to clear in the body. And those 3 vaccines are absolutely necessary if you remove a person's spleen. But somehow those vaccines were never given to him. 2 years later, on a beach, on vacation with his daughter, now new daughter, new wife, as a young man, he developed an ordinary strep infection. But without his spleen, he became deathly ill, septic, in shock, and he barely survived. What was striking about that story, when he crashed, he was cared for by good, hardworking people. They had every technology. We've got the best trained, hardest working people in the workforce in the country. But there was no system around what they were trying to do. And what was damning about it was not merely that they missed this opportunity for this one little step that could have gone right, but that no one learned a damn thing about it. Because I got that letter when we had just had the same case ourselves at our own hospital. And it turns out about half of people who have their spleens removed on an emergency basis somehow get this important step missed. The volume and extreme complexity of the modern know-how we've developed has exceeded our ability as individual practitioners to deliver it safely, deliver it reliably, deliver it effectively to society. And so now complexity has become one of the core reasons that we who do this work sometimes fail. Why those sometimes failures add up to substantial harm on a national basis. And it's a core reason why it often feels, in fact, it's proving to be unaffordable for our society as a whole. The worst part about it is the complexity is a core reason why it also fails to seem fixable. There are 13,600 different diagnoses, if I count all of the ICD-9 codes in my billing manual. 13,600 different ways the human body can fail. And in this last half century, we have now developed 6,000 drugs, 4,000 medical and surgical procedures that we can provide that can make extraordinary differences for people. There's virtually no condition for which, although we cannot cure everything, we can reduce suffering. There are two reasons why we might fail at anything we set out to do as human beings. One is ignorance. The knowledge does not exist, and therefore we fail when we make an attempt. But the second reason we can fail is ineptitude, meaning that the knowledge exists, but a human being or a group of human beings fail to apply that knowledge correctly. And the great challenge, I think, of our time and this particular century is that we have emerged from a century from which we have made so much gain against ignorance. By no means have we conquered it. There are enormous areas for which we are still in great bafflement, everything from autism, as you heard about, to Alzheimer's disease. But we have discovered an enormous amount and have not yet discovered how to ensure it actually gets to people in a consistent way. And so it was not ignorance that failed Dwayne Smith. It was ineptitude. Research is now showing us the extent of the opportunity as well as the difficulties. There is huge variability in the results that you may experience depending on where you go for your care. Huge variation in the outcomes, and as it turns out, in the costs. 2 to 3 times different survival rates. In cystic fibrosis, for example, you have a situation where survival is on average just over 35 years now from this disease that in the 1960s claimed virtually everybody before the age of 6. And that's a measure of our gain. But if you look at the bell curve of survival, you find that there are places where the average survival is more than 48 years now, and places where you go to that it's not broken the late 20s. Enormous variation. And the fact that there's also enormous variation in costs has led us to be greatly disturbed by this combination of findings. But I think that there's actually hope, because it turns out the two curves do not match. The most expensive places in the country are not the places that are getting the best results. The fact that the most expensive doesn't mean the best means that there's opportunity, because we could discover what the positive deviants are doing and be able to understand how to take that elsewhere and learn from it. And that is more and more what innovation is beginning to look like. As we've looked at what the positive deviants do, what they do differently, what you see is that where they are most like a system, they are most successful. A place like children's is showing us the way. And I think what is emerging is that there are key patterns to the places that make successful systems. And none of us in medicine have achieved the full pattern. And I think children's would be the first to tell you that that's the case. The first skill of an actual system is a commitment to data. This is not necessarily built into your bones as a clinician. You want to see what is right in front of you. But when you are only one of many in the picture, we are all specialists now, even the primary physicians. We all only have a component of care. And when that's the case, we don't see the end result, whether my mother is walking at 6 months after her procedure, whether my son is graduating from high school. It's only the data that can tell you, as a group of people, whether what you did was succeeding or failing. And the commitment to the data is a commitment to recognizing failure. The second skill of a system is a commitment to innovation, creativity around solving the problems that emerge from the data, being able to drive outcomes through changes and tweaks, disturbances in the system. But the third one, and I think it's the hardest one for us, is that you then have to implement what you've discovered and see whether it changes those outcomes that you were trying to achieve and implement at large scale. But the hardest part is that after we've taken that responsibility, what do you do to be able to get colleagues working across an entire chain together to bring technology and human beings to work successfully to drive the results that we hope to achieve? It's forcing us into more and more radical forms of design. Places where there are puzzles like, should the doctor really be the one in charge? Or places where you wonder, can we create an entire pit crew of people who somehow come together at critical moments and really function like teams? As we confront trying to become systems of care, what we find, once you put those goggles on, you feel like it's broken everywhere. And it has put us in a place where we feel like we're trying to solve all of the problems at once, and it's simply impossible. And so the knack we've had to develop is the knack for prioritization. The formulation that we've taken in the laboratory that we've built around at Ariadne Labs is one that I think mirrors what I think many health systems now are trying to do, which is recognize what are the most critical moments in people's lives when they turn to the health system, and how do we make those critical moments work the best. One of the ways we've done it is by looking at what the 5% of patients who account for the more than 50% of the healthcare costs, our sickest populations, what it is that they really need to achieve the best care, because many of these folks receive some of the worst care. They have the greatest needs, but because it's more complex, it uncovers the frailties in the system. But when we recognize that a few solutions, making life at the time that you enter the world so that you don't have to need that newborn ICU, is an opportunity to set people's courses so that their lives unfold in better ways, but also save costs down the line, all the way up through adolescence and identifying what the most important triggers are. What we're learning from all of this work is that the value of it dwarfs all of the value of other types of healthcare innovations. Is there a single asthma drug that can drop the likelihood a child will need an emergency room or a hospital for their asthma attack in the same way than making sure it's part of a bundle of items can do that? There simply isn't. But doing that work and being innovators that can create new systems is itself incredibly complex. Just as a practitioner can't provide the fantastic care on their own, so can we not do the innovation on their own. And virtually everybody I noted who came up here said, it wasn't just me, it was a whole team, and that's the truth. But that is not how we've built ourselves for recognition, promotion, and it's a challenge to the way we work in academia. Industry increasingly lives and works this way, but we've begun creating a world where you can do it. I was struck by a paper that came from a consortium of 12 different institutions, including the Broad Institute, that got front page headlines in the New York Times, ABC News, where they sequenced breast cancer genomes and found that there were four patterns of breast cancers where we thought there were really two types of breast cancer. And what made it have headlines was the realization that since there are four, you'd need really four different types of treatment laid out for it. What didn't get the headlines was that there were 348 co-authors on that paper. And will you be willing to spend your career to be author number 251? They did. And the result was they are transforming the way that breast cancer works. This is our chance, I think, to build the country's next major industry, starting here in Boston. Boston, I think, will be the Silicon Valley of healthcare innovation. There's nowhere that has the information technology and engineering community, the drug and device industry, the institutions of healthcare totally committed to transforming how we do our work, and the kind of young people, the clinicians who want to practice a new kind of medicine for the 21st century and not the one we've had. We did it in genomics and biotech. I don't see other places around the country that have this combination of what we have. So we're going to need your help, all of you here, to help do it for our systems in healthcare, not just for Boston, but for the country and for well beyond our country. If we don't do it, who will? What I'm excited to know is that Children's is doing it. This is our time, and I think we are all getting to be part of changing healthcare.